Welcome. I'm Dr. Lisa Toppin, and you're listening to Inputs to Action. Today, my guest is special. Special because he is an internal medicine practitioner, but particularly special because he happens to be my brother. So I'm pleased to welcome Dr. Dana McGinty. Dana,
Hey,
welcome.
Hey sis, how are you?
I'm good. It's good to have you.
Pleasure to be here.
And so, Dana, you practice medicine, have been practicing medicine out of the Washington, D.C. area for, I don't want to date you, but a couple, 3 decades. Your practice is McGinty Integrative Medical Center. And so we may even talk a little bit about that because I know that it has some other influences that make it integrative medicine in particular. But tell us a little bit, maybe this is where we start. Tell us a little bit about your practice. What does that look like?
Sure. Well, as you know, I'm born and raised, and actually Washington and Howard Bison educated as well, both undergrad and Bison as well. And I trained here in DC as well. So, I have a DC-based practice, and I've been doing internal medicine for 30 years. I'm in a typical, if we would call that, practice setting. I have converted a single family home into a practice. I don't live there, but my practice is there. And so that provides sort of a unique setting to deliver the sort of things that I do. So I do primary care. I'm also an acupuncturist. I'm consider myself pretty knowledgeable about nutrition and things like that. And so I try to give patients sort of a wholesome sort of sort of a lifeline to hang on to, a plan, a place to connect, and my staff, who've been with me for a decade, easy, sort of have a sort of family sort of environment for patients to check in.
Yeah. It's a total family feel. I think being in the house in particular sort of gives it that setting. And I know while your dog was alive, he was an active part of the practice as well. People love Barry. And so it's a special place, I'm going to say, with regard to that. And one day we got to talk about the acupuncture, because I'm a huge fan of acupuncture. But today we're really talking about telemedicine, and I think it's important to spend a little time talking about it because we're seeing it all over the place. I'm seeing in North Carolina, I'm seeing commercials for it. Everybody is sort of talking about now seeing patients by telemedicine, and that is because of COVID. So what has been is that really your entry into it? What has that looked like for you? How did your practice start to take on telemedicine the way it has?
Sure. I mean, we have used telemedicine in the past 3 months in a way that we had never used it before. Telemedicine, telehealth, however you want to call it, has been around actually for years. 2 things I think really propelled it to the forefront. One is, of course, COVID, as you mentioned, making people reluctant to come out, worried about their exposure in any healthcare setting. And so that was a driving factor. The other factor, which was really important, was a change on the part of insurance companies. And they changed their rules such that they will pay for telehealth in the same way they paid for in-person visits. And so that was huge in terms of, commerce for the physician's office to be able to generate that same sort of income with the patient at home. So it's changed dramatically.
Yeah. Do you find that they're open to it in the same way?
I find that they are. For a lot of patients, coming to the doctor's office represents a bit of a challenge. They have to get there, sometimes there's a bit of a wait. They may have to take off work, even if they're working from home. They have to maybe leave their home environment and come to the office. So a lot of patients are very accepting of it. They do recognize the efficiency of it. As I chat with them about the process, we both agree there will be times that I do want you to come in, and there are times that they want to come in because they want that personal connection that you get in person and that you just can't really get through the AV world. But as far as an increase in efficiency, certainly for emergencies, if you feel bad, you might not want to get in the Uber. You definitely don't want to get in the Uber anyway because it's COVID in Uber. So doing things from home is a huge advantage, though it's not appropriate for every visit. And so it's really kind of up to patients sometimes to decide if they want to be seen in person because they feel they really need to be seen in that way for it to be understood what's going on for them. And sometimes it's up to the doctor. If there's certain symptoms that you have, I really don't want you to come to the office because you'll be exposing the staff and other patients maybe to upper respiratory illness that we don't know what you've got. And so then, but I can manage that in this manner.
Right. How do you, in that frame, how do you manage a visit on the screen? So I'm gonna tell on myself a little bit. You and I've been doing telemedicine for about 30 years. As long as you've been a doctor, I've been calling you, going, okay, my arm hurts with this, and you've been advising me and directing me, and now my kids and the whole thing just from a distance. But for those who are not sort of used to it in that way, how do you do an examination over the screen? How does that work?
Yeah, I mean, it is something to get used to. And clearly, there's going to be some limitations of the kind of exam that I can do. I can't lay hands on you. So it's a visual exam. But there's a lot you can learn from observation. And, you know, as doctors, we've really been trained to observe pretty keenly. So I can tell if I'm talking to you, I can tell if you've had a stroke. You're talking different. Your face is different. I can see things. If your legs are swollen, I'll have you show me your legs with the camera. So the visual stuff, you've got a rash. I can see that. Show me your rash. So the visual things, yes, you do pretty well with that. The things where I need to listen to you or touch you, including things like blood pressure. If you've got a home blood pressure cuff, that's great. And, you know, certainly recommend that for anybody that has high blood pressure, or even if you just want to part of your health maintenance and you're going to check your blood pressure periodically. I think it's a great idea. But that's something that if you don't have that and you're not in the office, I don't know that. I can't listen to your chest. I can't listen to your lungs and your heart. So there are some limitations there, but there's a whole lot that I can gather by talking to you and seeing you, and which makes it superior to the phone call, which was what insurance companies and didn't want you to do before, is to have a phone call as a visit. They just saw that as so different from an in-person encounter that they did not recognize that as a visit.
And so the screen capability, that evolution of technology has really given it the additional dimension that have allowed insurance companies to say, you know what, we can't get to everything, but we can get to a lot in this way.
It's close enough. And certainly then again, it's up to the judgment and discretion of the physician as to whether it's enough. And I have had those patients that I've been talking to, and I say, hey, look, you need to hang up from me and go to the emergency room or go to urgent care, because I can't tell you enough about what is going on. I can't discern what is really happening for you, and you need to see someone in person. Yeah. So sometimes that's the advice, but it's still helpful for me to decide if that's what you need in this manner.
Yeah, no, you and I've had one of those conversations too. And I was like, well, I've got the kids like, why are you still talking to me? In your car right now.
Right. I have given you my best judgment.
Right. And then Big Brother kicked in and was like, but you should be in the car.
Right. There you go. There you go.
Okay. So now here's what I want to know about. And I think you can really give us some insight into this, because men are notorious for not going to the doctor. So what's that about? Why won't y'all go? And does telemedicine now allow us to hurdle that?
That is a very good and a funny question, because it's also true. When a guy, almost no matter what his age, shows up at my office by himself, my first question is, who sent you? Your girlfriend, your sister, your wife, or your mom? Because you're right, guys without some sort of outside impetus most of the time don't show unless they're really sick. And sometimes that's unfortunate, because then things have happened and the outcome is not as good. I think guys are not focused on that. Guys really think more about our mission, you know, and our mission is, for most men, is to provide and things like that. And we're counting on our invincibility for that to continue. We don't really want to consider anything that doesn't go along with that story. I think men too disconnect from the medicalness early after we finish with the pediatrician. Unless you get sick, there's kind of really no reason to return. Whereas women are continuing to go for pap smears and they're having kids and things like that. So they sort of stay connected to that process in a way that men don't. I think men worry less than women. Women worry more. women are more anxious, and that's kind of been shown, even in a pathologic way. But some worrying is good, that's for sure. And having concern about your health and trying to see into the future is never a bad thing. So I think those are the factors kind of involved, and it all adds up to guys not showing up as much. Now, as to whether the telehealth thing would improve it, I would say yes. I would say that it would maybe allow a man to see it as less of a hassle, something that he can take care of at halftime on a football game, or just before Monday Night Football, maybe, if his physician is flexible with the timing. And I think that could be helpful. You do want to initially connect with your patient in person. So for first visits, I'm not crazy about telehealth. In fact, I really don't allow it. If you've never seen me, you got to come see me first, so I can know you, and then we can distance a little bit like this, and I can still feel like I know who you are. And so, but in terms of maybe having a female involved with the call, and she says, "Sit down, honey. We're going to call Dr. McGinty right now. I'm going to get him on the phone. You don't have to do anything but just answer questions. I'm going to check your blood pressure with this blood pressure cuff. Talk to him. That's all you have to do." And guys will go from there.
Yeah. Okay. That's good. I mean, I think, and I think, let's say, making it explicit, women, that we do really carry a big role in making it happen. Like, let's not shy away from it. Let's just lean in. And I think the other call out you made that I didn't appreciate is, you do, as a female, you do start seeing a doctor and you never stop. Right. And guys don't have that same relationship. So it's a different dynamic. And I can see how if you're healthy, that you wouldn't necessarily run off to the doctor in the same way. So, okay. So you talked a little bit about sort of what that relationship is. What do you need to know? So from a patient perspective, I'm going to see a doc by telemedicine. What do I need to know? How do I show up, or how do I get the most out of that visit?
That's a good question. And there are some things that you can do as a patient to make the most of the doctor's time. One is to make a list. And sometimes lists are scary, but I like, because it seems long, but most of the time, if they're long, they're just redundant. And so, but I like when a patient has a list, because that way, when we finish with their list, then their concerns have all been addressed. And so when they leave, they'll feel like, well, we talked about everything. And so I think that would be, if you could do that, if you could review your family history, so that if you haven't talked to your mom or dad, if they're living, or your cousins or whatever, about things that are prevalent in your family, those are things to know. It puts the doctor on guard, and he can advise you, about lifestyle things and things that you can benefit from that knowledge. And other than that, there's really not that much preparation. Bring your medicines if you have them, so that they're, because I have patients that come and they say, well, I take this red pill in the morning. I have no idea what that is. And then it's like a Sherlock Holmes mystery. And so bring your medicines. And if you have any pertinent paperwork, recent labs and things, what you don't have to do is bring your whole doctor's chart from the last 30 years. Right. It's full of normal exams and normal blood work. And I really don't even want to look through all that, to be honest with you. Right. Bring me the recent stuff, bring me the abnormal stuff, the old stuff you don't need. Bring me your medicines, bring me your family history, and everything else you can tell me. It's all about history taking. And you'll be able to tell me everything that I need to know when you're there.
Yeah. Clear instruction. So one of the things that I've noticed about I'm going to say medicine over the years, because as we talked about, you continue to see the doctor on a regular basis. And now once you get to a certain age, it really seems like you're seeing the doctor and all kinds of probing and exams.
Sure.
It has evolved in a way that sometimes makes it feel very transactional. Like it feels like the doc is in and out in 2 minutes and 45 seconds. Like they're in, pleasantries, they're typing, they're examining while they're typing, and then they're out, right? How does telemedicine change that dynamic, or does it?
That is a common complaint for patients, is the amount of time that you spend. To me, it's important to spend enough time. You say, how much time is enough? Well, time enough. I should hear everything that you have. I may say that's enough time spent on that problem. Right. Let's move on to the next problem, because there is a finite amount of time. What's driving that transactional nature is that this is a bit of a numbers game. And it's like any sort of production line. If you don't hit your numbers, you can't stay open. So there is an incentive on the part of the physician to limit the time of the interaction. Now you got to, of course, you balance that with the quality of your interaction, and if you don't get a good history, because it's all about that, if you don't take time to establish rapport, you should remember who's got kids and who doesn't. You might not remember their ages, but you should kind of know by talking. And so you have to spend some of that time doing non-medical talk so that you can connect as a person. And that's going to be required. I try to do that in telemedicine as well. I don't necessarily just jump straight to the business. How you been? How you hanging? Life is crazy, isn't it? How you feel? See all the protests. And we kind of have to go through that. So we kind of set our environment. We're living in the same world, sort of thing. Proceed from a similar place. It's the sort of the diametrically opposed workers versus owners sort of setup. You have a patient who wants all of your time. They would love to talk to you for an hour, but if you spend an hour with every patient, you would be closed in 2 months. Right. So there's a balance there. You got to strike it. The telemedicine really has the same sort of dynamic going on. I think, if anything, though, it makes it a little bit more difficult because you're not there in order to deliver that personal energy that you can in person. There's no substitute for that. So in telehealth, you kind of have to work a little harder.
Okay.
Work a little bit harder.
Yeah. What do you do? How do you give me that personal feel? I mean, I'm on Zooms all day, every day, and I see people working harder to be connected, but it isn't the same as being,
It's like this. We are body language fiends. We're body language fiends, where they say 90% of the transmission of information. And so I try to give body language, hands. I try to, but it's not as good as if you're with me. There's small things that you can't see, what I'm doing with my legs, things like that, things that I could see you doing, it's what I call FBI work. And it allows, if I can see all of your body language, now I have a whole nother level of information coming. I can tell how you feel about something I'm telling you about. That's going to inform me. Maybe I need to stop talking about it. Maybe I need to talk about it more. But when I'm in person, just the level of the information stream is richer. And so, I, from my end, try to give the patient more body language information. Like I try to be more expressive. I pretend I'm an actor on TV in a way and try to be very expressive so that you know how I feel. You know what I'm trying to deliver to you. It's like you got to act a little bit, not in a bad way, but just more expression.
Yeah. It sounds like you are very intentionally bringing more of your full self to the camera, if you will. Let me say it that way. Then it's not inauthentic, like it's a role that you're playing, but it is. I could say this and I could give it real emphasis. And so I'm going to give you my hands and I'm going to really make this point.
I'm just turning up the knob a little bit. That's all. It's all the same stuff. I got to turn up a little bit because you're not here.
Yeah. Yeah. No, okay. I think that's really helpful. I'm hoping that people have the opportunity to really consider and leverage this, because I don't think that we're heading out of COVID anytime soon from everything that's being said. And we don't want folks to stop going to the doctor. Have you seen people not going to the doctor, or have you seen that change?
I have. And it's interesting how I figured it out. So I have an electronic system to renew medications. And it's one of the ways that I can figure out who's been coming and who hasn't, because when you run out of medicine, it's because you haven't been there. Mm-hmm. I'm having more refill calls, and it's all electronic, which is great. These aren't telephone calls, but there's more than ever. And they're from people that haven't come. It does give me an opportunity when and sometimes I deny the refill and say, no, you got to come. It's a way for me to remind you that you must come. But I'm seeing more of that than I have in the past.
I got you.
So people are really being conscious about coming out. Especially, I have a strong Medicare population. So these are people at higher risk, 55 and over, and with concomitant, underlying conditions, as they call it. These people are wary.
Yeah. With good reason. But this allows us to hurdle all of that. I mean, It
does. And so part of my job is to make sure that they are aware that it's an option, because a lot of them think we're closed. They're not even sure we're open. They didn't call. they think we're closed because they've heard about, non-emergent care and dentist's office being closed as well. So I did at one point, and I'll probably do it again, send out through our electronic system an email blast, just kind of letting people know that that's available. And, on my Facebook, not Facebook page, but on my webpage, I talk about it, the things that we've done to adapt for this COVID environment, including things that we're doing in the office. We have really slowed down the in-office flow. And there's no more than one person in the waiting room at a time. People go directly back to the one person in the lobby. Sorry, they go back to the waiting rooms directly. We're disinfecting all day. We're wearing masks. Everyone who comes in must have a mask. Anyone who is sick in that way. So we're doing our best to protect our patients, make it a safe environment.
There you go. That's what you with 30 years of experience. So appreciating that. So you've given us great input. And so this show is all about inputs to action. So what would you have us now do? What would you advise us to do with all of the great advice that you've given us so far?
Thank you. I would say this. I mean, it's health is a proactive thing. It's one thing to try to get better after you're sick. It's another thing to try to stay well. And so wellness is my message. And there's several ways to achieve that. It starts every day with what kind of foods you're putting in your body. Are you having a lot of sugar? Are you having lots of pasta? Things that take you in the wrong direction. Have you had your colonoscopy? Have you had your mammogram? Have you had your basic blood work? I mean, these are some basic things that you should do. Have that telemedicine visit with your doctor. And it's not like you have to, visit the doctor once a month or something like that. These are just some basic things. If you do them in a reasonable amount of time before things happen, then you can avoid a lot of heartache.
Yeah, that's it. Because there's nothing worse than being sick. You know what I mean? And then you're really kicking yourself if you could have done something to avoid it. So advice well taken. So thank you. I appreciate you taking the time. And as we continue to celebrate Father's Day month, as it will,
there you go.
Having a particular lens on how we're going to use telemedicine to get our men to see their doctors and keep them well. So thank you for that as well. Absolutely. You have been listening to Inputs to Action. I'm Dr. Lisa Toppin. My guest has been Dr. Dana McGinty. Thank you so much for being here. And thank you all for listening.